So why do we need to focus on the risk of surgery for scoliosis? First, to remind you, scoliosis is technically defined when we have a lateral bending of the curve of at least 10 degrees with rotation. Now, one of the reasons surgery is frequently recommended is because in the orthopedic centers and hospitals, that's the only treatment they offer. So if you only have one treatment, you only have one thing to offer. And doctors a lot of times are not familiar with non-surgical treatment options. Now, surgery is most often recommended when curves get more severe, typically when they get over 45 to 50 degrees, or even sometimes when there's a smaller curve but the risk of progression is extremely high. That's when surgeries are most commonly recommended. But it's really important to be well informed of non-surgical treatment options. The goal with scoliosis-specific exercises and bracing is to keep the spine from progressing to surgical levels and in many cases trying to reduce the size of the curve. In adults, the goal of surgery is the exact same of bracing and scoliosis-specific exercise: to reduce pain, to allow the patient to function at higher levels, and to stop or slow the progression of the curves, and in some cases even reduce the size of the curve. So if the goals of non-surgical options is the same as surgical treatment options, you should always exhaust non-surgical treatment options first before progressing to surgery. Because the worst thing that can happen with a non-surgical treatment option is it just doesn't work. You can always go do the surgery then if needed. But the consequences of surgery can be very severe if the surgery is unsuccessful. So what is surgery for scoliosis? So when it comes to surgery, we have fusions and we have non-fusions. And they can both be used, and there's times when we can choose one versus the other. Non-fusion surgeries are an option when someone is still growing. And what we do in non-fusion is they actually use something called tethering, where they're putting a screw in the vertebral bodies. Because when someone's growing with scoliosis, part of the vertebrae is growing faster, part of that vertebrae is growing slower. And they put the screw into the vertebrae, and it basically will stunt the growth on the side of the vertebrae that's growing faster, thereby letting the side of the spine that's growing slower to catch up. The good thing about doing things like tethering is you don't have as much blood loss, it's less invasive, and you're not actually fusing any of the spinal segments together, and a lot of times the patient can function at a high level when it's successful and in appropriate cases. In more severe cases or very stiff and rigid cases, a lot of times that they'll do fusions. Now, with fusions, they can actually do rods that can be lengthened as the child or adolescent grows. Or they can do fusions where they fuse all the vertebrae together. The goal of fusion is, one, to straighten the spine or reduce the size of the curve, and in adults, a lot of times also to help reduce pain. So what are some of the risks with surgery? Well, there's four main ones I want to go over with you. One of those is infection. Whenever you're doing any kind of surgery, one of the biggest concerns is the risk for potential infection. Now, when you're doing something like adjustable rods and they have to go in and do those adjustments every 6 months, every time they have to go in and do that, that opens the door for other infections. So infections is one of the biggest concerns with any surgery. Another one is bleeding, especially when you're doing fusions. A fusion can cause a lot of bleeding both during and after the procedure. And if there's a lot of bleeding, that opens the door where someone may actually need a blood transfusion. So bleeding can be a big concern. Pain. Just because someone gets a surgery, even if that surgery is for pain, doesn't mean they're going to be out of pain. Some people even have more severe problems post-surgery than they did before. And that ties into the other big concern is potential neurological injury. Somebody can have a surgery and they can get a nerve root or possible spinal cord injured, and that can cause more pain or cause problems with whatever those nerves control. So the four big concerns with surgery are infection, bleeding, increased pain, or possible neurological injury. What are some of the risks specifically tied to spinal hardware? One of those is the hardware could break. Like in tethering, you have a tethering cord between the actual screws that go in. In severe cases or larger curves or stiffer spines, those cords can actually break, where they may have to go in and replace those, causing a second surgery, increasing the risk of other infections and bleeding and all that. In the growing rod fusions, where the adjustable rods, those rods, or where they attach to the spine, those can break themselves. Rod migration or dislodgement. The rods could actually move or migrate or dislodge, causing a lot of discomfort for the patient. And the hardware itself can cause a lot of discomfort or pain for the patient. What are some of the long-term potential consequences of surgery? One, when you do a spinal fusion, you have lack of flexibility. Any of those vertebrae that are involved in the fusion are no longer going to move. That can actually affect the vertebrae both above and below it, causing what's known as adjacent segment disease, meaning these segments that are adjacent to the fusion, they have to make up all of that work for the areas that are no longer moving, and that extra work causes adjacent segment disease or degeneration and arthritis in the segments that are adjacent to the spinal fusion. That leads us to increased likelihood of arthritis and degeneration in the non-fused segments, and especially in the segments that are right next to the fusion. Flat back syndrome or loss of normal curve. Now when you do a fusion of the scoliosis, they try to keep that curve in there, but a lot of times the fusion in the lumbar spine can actually lead to an increased loss of that lumbar curve. And a loss of the curve in the lumbar spine is directly associated and correlated to increased likelihood of chronic low back pain. And then there's also a pseudoarthrosis, where the fusion doesn't actually fuse or heal like it's supposed to, leading to other long-term problems, pain, and discomfort for the patient. What are some other expectations or considerations with surgery? One is the recovery time. Someone that has a spinal fusion, that can take several months to recover from the procedure itself. Another one is the revision. If the surgery doesn't work as well as planned, they may need to have revisions. I think about 50% of spinal surgeries need a revision within 3 to 5 years. So it could lead to subsequent and additional surgeries. And a lot of times if they don't fuse everything that they think they need to, they may go back there and start to fuse more an additional segment. And then the psychological impact and just dealing with post-surgical implications or expectations. Some patients just assume if they go in and have a surgery, everything's going to be fixed and they're going to do better. But a lot of times that's not the case. So you could have someone that expects they'll just go in and do surgery and life's going to be all good, and they could have the same problems or even more severe, or just not get the results that they were completely hoping for from that surgery. So afterwards, psychologically, that person could be depressed because they didn't get the results they wanted. So what are the alternatives to surgery? So here at Scoliosis Health, we do ScolioBalance, which combines the most effective scoliosis-specific exercises, Schroth, C's, and chiropractic biophysics. That's known as ScolioBalance. And we also do custom scoli bracing, and a lot of times we will combine scoliosis-specific exercises with custom bracing, because we know combined, those tend to get the best results and best outcomes for our patients.